Today, I'm joined by Lauren Payne, practice manager at Integrity Veterinary Center in Northampton, Massachusetts. Integrity is a specialty and urgent care hospital open late hours with a philosophy that's simple but heavy to carry. Do what's best for the patient. Lauren sits at the center of turning that philosophy into daily reality, managing staff fatigue, referral bottlenecks, and the constant tension between medicine and money. We're going to get into the hard parts of making mindful medicine sustainable. Lauren, please introduce yourself and what you do at Integrity Veterinary Center.
My name is Lauren Payne. I'm the hospital manager for Integrity Veterinary Center. We're a specialty and urgent care beginning of next year. We're also adding ER services. From a day-to-day standpoint, I handle all of our financials, a lot of our general planning. I no longer handle our day-to-day employee concerns. We have a nursing supervisor and an HR and office administrator who has those roles. Inventory still on my plate. Same with all of our DEA requirements and, OSHA safety. This week is our 3-year anniversary from when we opened. I think it's technically prior to that, I worked at a specialty and emergency hospital in different capacities. I was there for not quite 3 years before I moved here. That's how I met the practice owner for this hospital. Prior to that, I managed a GP office for about 3 years, and prior to that was a veterinary cardiology only office for about 8 years.
My gosh, you have a lot of medical management experience. What pulled you into veterinary management?
Honestly, it was luck and happenstance. I actually had left the field. I went back. I have a master's in counseling with a focus on student development, higher ed. I left the field. I was doing policy work. Then the economy kind of crashed. Where the office I was at were grant and contract funded. So if you lose a significant grant, kind of last one in tends to be the first one out. I was actually still working there part-time. I used to be heavily involved in dog shows, and I had organized a breeding clearance clinic for one of our clubs. The cardiologist I ended up working for was there looking for a part-time person. So I just sort of was working 1 day a week, and then her manager was leaving and she offered me full-time. So for a while it was full-time there and part-time policy work. It really was just kind of happenstance.
You're open most nights until 11 p.m., and that is so rare in specialty medicine. So, where do those hours push your team past its limit?
Our specialty departments are not open that late, just our urgent care.
Gotcha.
So our oncology department, they finish at 5. Ultrasound or outpatient imaging, which is our ultrasound, and they do CTs also. They're also out of 5. Internal medicine depends on the doctor. One doctor's here till 7, one is here till 5. But our urgent care is open until late hours.
How does that push your team?
One of the things we work on is work-life balance. We don't hire with rotating schedules. We hire people with specific days and time schedules. So if you're always working, we have some people who work 4/9s, some who work 3/12s. We have a couple who work 2/16s and a 4. I don't know how they do the 16s, but it works for them. And so they always know every single week if your schedule is Monday through Wednesday, you're always working Monday through Wednesday. We post schedules if we have open shifts because somebody's on vacation. We have good staffing ratios. We generally have 2 nurses and 1 assistant per doctor on the weekends where it might be a little busier or a little more chaotic, where we actually have a little higher ratio. And it's also a day, Friday, Saturday, Sunday, we don't have the specialty services in to help if urgent care is really slammed. So we include a higher number of staff on those days to try to balance out that, when people are on vacation or sick. We appreciate when people pick up hours, but it's not, we don't require that somebody pick up shifts if we're short. We just ask that if you are short, be a team. And if we're very short, like skeletal short, we actually allow the doctors to block off some appointment times if they need to, or if we're good until maybe 10 p.m. it may be that we block off that last 10 to 11 appointment so that this way, we aren't seeing patients when we don't have the appropriate staff.
What kind of
Yeah.
support staff do you have all the time?
So we always have nurses, veterinary assistants. We have levels within our nurses and our assistants, but our veterinary assistants, their level twos are essentially some cases there are people who are happy being like a high skilled assistant. They don't want to be a nurse. But most of our level twos are working on becoming a veterinary nurse. So they can place catheters, maybe not really tricky catheters, but they can place on a standard patient. They can, run your IV pumps, your fluid pumps. They're learning how to do like CRIs. They can do a lot of the same things as our nurses. They just might not have sedation monitoring and they might have not have anesthesia yet.
Mhm.
So that's very helpful. Our level ones do a little more of the restraint, the cleaning. Our assistants and nurses are all expected to be able to take history. So that helps balance that workflow and keep everybody from being overwhelmed. And then we have CSR coverage from 8 a.m. till midnight as well. So we always have two receptionists in the evenings.
How many
Not that bad.
veterinarians do you have that you're managing?
We have 10 to our regular part time, but the other eight are full time. Five are specialty, the other five are urgent care.
You must be really good with lots of different personalities.
We very much push open communication. So we want people, if they have a problem, to talk to the other person about it because there's so much that is sometimes simply miscommunication. Somebody took
Mhm.
something. So we really encourage that. We will mediate if we need to. And we encourage everybody to give somebody some grace, talk with them, the same grace you would want. We don't allow aggressive behavior or anything from our clients. They actually signed a client conduct agreement, so that helps. But the same goes to our staff. If our staff are behaving in a way that's inappropriate, we have talked to them, we've mediated. We will not keep a staff member, no matter how skilled, that is abusive towards their fellow employees. A lot of places will keep highly skilled employees on. We will not do that because it doesn't result in a good work environment for everybody.
Absolutely. I'm guessing because you have such a strong focus on specialty medicine
Mhm.
that you have a lot of referrals that come
We do.
to, is that
Yep.
right? When you're thinking about referrals, what
Mhm.
actually derails them most often? Is it the missing diagnostics or incompatible files, unclear urgency? What happens?
Oftentimes we appreciate when we get a referral letter from the primary care, but it's not a requirement.
So the
What
client
often,
can directly
yeah,
schedule with you if they want to.
we usually do ask that they call their vet. We want to review their records before we schedule because there are times where you look at an issue and it's like outpatient ultrasound actually might be better than, say, internal medicine because it's not clear that it's an internal medicine problem. It could actually be an oncology problem. And we want people to get to the right place first.
Mhm.
That's a sorting point for some of them. The biggest stopping point is when we get records and we're not sure why they're being referred. Like there's no mention of it, there's nothing in the record that clearly tells us there's a concern. Then we just reach out to the primary care vet or whoever referred them and ask for more information just to get clarification as to,
Mhm.
what the client needs because we do want to get them to the right place first. I don't want to send them to internal medicine when they should be in oncology. We do have
Right.
shared patients between our various departments, but that's usually the biggest stopping point. And then if it's urgent, such as lymphomas with oncology, our urgent care doctors are actually trained to be able to take in those lymphomas and start the process. Lymphomas are so time sensitive. We don't want the patient waiting, 3 weeks for our next 3 or 4 weeks till our next consult's available. So, in the same with if there's any other particularly urgent oncology situation, or even internal medicine where you have like an unstable diabetic, we may have them come into urgent care and do interhospital consult, or start the process there and get that internal medicine consult scheduled.
Mhm. If I shadowed a shift,
Mhm.
what repetitive fire drill would I see your staff handling that makes you think, "Oh my gosh, this should have been automated yesterday?"
One of the pieces that we are automating with our updated website is our client conduct agreement and getting that out to clients before they get here so that they can sign it and then we can just get it digitally uploaded. Unless they don't have email. We have some clients who don't, which is fine.
Mhm.
Or we don't generally see walk-ins. We sometimes get them, and if we can see them and they're urgent, we will. That will be helpful because it'll save the time of everybody confirming that they've signed it, because until they've signed it, we won't provide treatment or care. So that when our new website is, that's a piece that'll be included. And then we're also going to implement a more detailed history report that we can send to the clients to have them complete ahead of time,
Mhm.
because that will be helpful in keeping those histories short. That's a learning curve for all staff. It just takes time to really take a complete history in a short period of time, how to rein in the clients who are really chatty, or how to get information from the clients who maybe they're not the right person who has the information, or they're not as forthcoming because you're not a doctor.
Mhm.
So that's going to make a huge difference in terms of our workflow. That'll be coming probably the next couple of weeks. I think our new website is almost done.
Is there anything that you wished for that wasn't coming up next? Like any kind of tool that would really help you out?
We regularly look at our processes and procedures. We have monthly staff meetings and we regularly talk about what should be different, what can we do better. We regularly ask our staff and get feedback from our staff as to ways to make something more effective or more efficient. That enables us to act more quickly than some places.
So there's not even just one quiet tool that could take weight off tomorrow, whether it's triage calls or referral intakes or owner updates. What is that one thing that would just
Honestly,
free up
not.
your team?
The client conduct form really is the kind
That's
of
the big one.
biggest, it's the big one. I mean, it really is. One thing we talk with our CSRs all the time is I would rather it take you a couple minutes extra and make sure you do it correctly, you have the right information, than potentially rush through something and miss something that's critical. And I
Mhm.
think that's one area that some practices don't do well, is sometimes speed is not to your benefit. Sometimes
Mhm.
taking that extra minute and making sure you have everything you need is better. Experience plays into that. If you're newer in the field, it's going to take you a little bit longer to get there versus somebody who's been in the field for 10 plus years, particularly if they've worked in specialty or ER. You're at a different starting place.
Do you ever see your staff going through the initial stages of burnout? And if so, what do you do to help them?
With our current staff, what I find is because of our work-life balance and many of our employees are younger, we're not seeing that same level. I will say we do see it with some of our older staff. We've had a couple people who we were kind of their, I guess, last stop before they left the field. What the feedback we got was that we provided them with the environment and tools where they didn't feel burnt out. We made sure everybody has a late day. If it's your late day, you stay till it's done, which is rarely past the end of the shift. Everybody has an on time day. So if it's your on time day, that means, unless there's a patient coding, if you're supposed to leave at 8 that day, you're supposed to actually leave at 8. We make sure people actually take a lunch break. That's been a challenge for us,
Mhm.
is making sure people actually assign themselves a lunch break at a reasonable time, actually take it, and that they're not, we don't reward being a martyr. We don't reward that behavior of I've taken on so much and now I'm tired and burnt out. For us,
Mhm.
that's not success.
Mhm.
Success is making sure that workload is relatively evenly distributed as possible. There's going to be days it's not perfect, but we don't want one person taking 6 cases. We want that workload split. And I think that makes a big difference. It is an adjustment for people who have been in the field for a while. Anybody who's been here in the field for a long time knows that your tendency is not to take lunch. If it's
Mhm.
crazy busy, your tendency is not to make sure you round your patient off to somebody else and actually take that lunch. Well, when it's crazy busy, your tendency isn't to leave on time like you're supposed to. Your tendency is to want to stay. So breaking those habits with our older employees has been a challenge. And even with some of our younger employees, because it's different than many places, but we find that that makes a huge difference. When
How do
people
you
can
address
actually,
it with someone who doesn't take a lunch break and doesn't leave on time?
we do a couple things. We actually have a schedule posted. All the departments have their own uh, schedule in terms of when people take breaks. They post it on their department whiteboards as to what time they're supposed to go. Our team leads or our nursing supervisor make sure that people go. And when people say no, the doctor will follow up and say, yes, you are going right now. You are rounding this patient and you are going. We have done improvement plans where we've had to sit down and be like, this, you have to change this behavior. It is not healthy for you.
You have to
But
take time off.
like you need to actually take your lunch at a reasonable time. It's not okay to be so hungry that you're hangry.
Right.
Like none of that's okay because it's also not good for patient care. I mean, at the end of the day, if you're tired and burnt out, you're more apt to miss something or,
Mhm.
not intentionally, but you're more apt to miss something.
If you could rewrite one industry norm, what would it be?
It is that notion of rewarding that martyr personality of let me take everything on, let me always stay. When you deal with people who are oftentimes that caregiver personality trait, they tend to be good at giving time, but not good about giving time for themselves and
Mhm.
about realizing that they need boundaries, they need space, they need time to breathe. And, our industry historically, and I think most places, reward the people who just, go, 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 who always pick up the extra shifts, who always stay late every day, instead of saying, hey, this isn't healthy. I've had a couple employees who picked up shifts, and I'm like, hey, they picked up this many shifts. We need to check in with them to make sure that they can actually handle this. I'm finding most of my employees are really good about self-regulating. They might pick up a couple extra shifts one week, but the following week give themselves a break. I
Mhm.
think that's because we do check in with them when they've suddenly worked 52 hours in a week. And that might be that they just picked up one shift because we have a lot of 12-hour shifts. But we
Mhm.
still check in to make sure, hey, is this something you can handle? Are you handling this well? It's
Yeah.
just, I think that's healthcare, not just veterinary medicine. I'm sure it's in the healthcare fields in general.
If you had a magic wand that you could wave and change one administrative thing, what would it be?
Ooh, that's a rough one. I think as a manager, we tend to have more on our plates than we should. Part of it's because the margins are different in the field. We tend to prioritize making sure I have ample support staff for our doctors and for our patient care, but maybe not adding in that next level of another administrator to take on some of those other responsibilities. It's all time consuming. The larger you get, the more there is. I think many administrators in smaller hospitals, they don't just do practice management, they're also techs, they cover phones, they do all of that and making it a clear line that that shouldn't be the norm. I get it in a really tiny place. The cardiology office I managed, we had the doctor, myself, and two support staff. Practically speaking, we were open 5 days a week, but I had a day where I was just doing management responsibilities. We had multiple locations, but on that particular day, I didn't go to that site. It worked well because we were smaller and I could fill in. And I did, I was really regularly part of the day to day team as well, but we were very small. But I think when you start getting to practices that are, 12 plus people, that if you don't separate out what you're doing, you're going to work hours that are
Mhm.
above and beyond.
Are you using AI and AI powered automation in any way in your clinic?
Not particularly, if you will. I occasionally dabble with like Chat GTP and things like that, but we don't use a lot of AI. We don't use AI for any of our radiographs. We actually just use a radiologist for all of that. It's something that I haven't really explored truthfully, and I'm not sure, other than occasionally for some phrasing and wording, running things through a Chat GTP process, how I would want to integrate it into our system.
Mhm,
I mean, I
mhm,
guess arguably we do use scribe notes for some of our doctors generating summaries.
mhm.
So that the doctors who like that and that works for them find that that's a huge time saver.
Looking 5 years out, what would be a perfect practice?
In 5 years from now, hopefully, we will have our ER fully up and running. We actually have a 5-year build out plan, but our ER should hopefully be fully staffed. We should have at least one boarded surgeon by then, possibly a neurologist. Sort of depends, but our goal is to build a larger specialty center, be able to have a building that's significant size where we do CE for the area. We could actually host it on site versus, renting or going to various restaurants in the area. We want to actually regularly do a symposium for not just doctors, but for the staff. We are working on an internship program for CBTs. There are colleges, or there's a community college in our area who offers one, and we are an internship site for them. But we're actually working on kind of developing our own and then reaching out to a few places that have that so that we can create that pipeline because it fits well with what we do for onboarding. So it's a natural fit. But we kind of want to be not just a specialty referral, but a source for CE for the community. And we do public outreach also. So we'd like to do more of that. There's a local co-op that our specialists have done. I think we've done 3, the public. One was on elderly pets. The last one was on, there's a nutrition bit to it because one of our internists is also board in nutrition. I'm working on putting together something about paying for veterinary care and doing some presentations in local libraries to talk to people about, okay, you've got a pet, so let's make sure we have a plan because care is expensive.
Mhm.
So we want to do more community outreach to not just here. We also would eventually like to have a social worker for both our staff, but also for our clients. And ideally be in a place where that social worker can host grief support groups or planning for oncology patients. We've had a few who they've never gone through that euthanasia process.
Mm.
And it's always good, even if it might not be for a lymphoma patient, some live out a year and a half, but to know like, okay, how do I prepare myself for what's eventually going to come?
Mhm, mhm.
So that's where we're looking to go.
Is there anything I didn't ask that you would love to add to the conversation?
I don't think so.
Where can people connect with you if they wanna learn more about Integrity Vet Center?
So our website is integrityvetcenter.com. Our phone number, if they're looking to like make appointments, things like that, is 413-614-0039. If it's management related and they want to connect up with me, I'll give our generic email info@integrityvetcenter.com. And then the team will make sure that ends up with me as well. But we have a lot of information on our website. Once our new site comes up, there's going to be even more information. We're going to have kind of some standard pricing information for clients because we want to make sure, we're very open as best we can with fees and what we offer.
Thank you so much for joining me today. I really appreciate it.
Thank you.
Thanks for listening to Behind the Gate, where we get real about what it takes to run and sustain a pet business today. If you found this conversation helpful, share it with someone else in the industry who might need it. And you can watch every episode on our YouTube channel. If you're ready to make your own business a little lighter and more efficient, you can learn more about what we do at vellum-agency.com. See you next time.